Today, like I said, we'll be discussing sexual anxiety. So what is sexual anxiety? Sex has many benefits. It has emotional benefits. It has psychological benefits. It has physiological benefits. Oh, sorry, ladies and gentlemen, let me take this call, please. Sorry about that, ladies and gentlemen. It was one of our facilitators that I had to make sure that he was on. Yeah, so like I was saying, sexual anxiety is a problem. Some people do experience it. There are premeditating factors that dispose people to experience that. What are these factors and which affects their mental health, by extension, the quality of life of this individual, of the relationship of the couple, the health status of the couple themselves, and other issues. Others use coping strategies to deal with the issues about sexual anxiety. Are these coping strategies, are they right or they are not right? We'll be looking at all of them. At the end of the day, this my facilitators who are expertise in academia and in practice would provide us with effective current coping strategies for the problem of sexual anxiety. So that is what we'll be looking at today. As usual, to state the housekeeping rules, ladies and gentlemen, let me say that it's a sensitive issue as usual because it's mental health related. So I would implore you to be sensitive in your comments and remarks. Again, please mute your microphone so that there will not be so much distraction. If you want to ask a question during the question time, as usual, click on the raise hand button. I would see that you raised your hand and I would ask you to ask your questions, make your comments or suggestion. Okay, that's by way of it. I think that to show that Mental Health Authority is serious with this program, our Deputy Chief Executive is also part of us today. I would invite her to make a few comments, then we can go on. She had, Dr. Misa, are you there, please? Hello, Dr. Misa.
Hello, okay. I wasn't being able to unmute. Hello,
Oh,
good afternoon.
Okay, Good. We can hear you now. Please go ahead.
Thank you very much, Dr. Arthur. And I just want to use this opportunity to welcome all of us to this month's seminar on mental health. I'd like to take advantage of the program to say that Prof was supposed to be on it, but unfortunately, some other engagement has taken him out of Accra and he's not able to join us currently as we speak. But I want you to trust that he is behind all this. He's very much fully aware of the topic being discussed and the impact or the importance of it on our mental health. I believe some of us may want to know why we are discussing sexual anxiety on our mental health, but we all know that our reproductive lives are part of our lives. Sexually, as human beings, we are also adults who are sexually active, and we may not think about it in certain ways which we think may affect our mental health, but we have with us seasoned resource persons who are going to discuss how such things which we seem or think may be very normal as part of our lives may affect how we think, how we feel, and how we even behave. So this afternoon, we are a little bit behind time. I won't talk much. Dr. Arthur has given us a brief concept of what we are going to talk about, but basically we want to draw our attention to what sexual anxiety can do to us. We also want to know how we can deal with it. What are some of the strategies? If it is an inappropriate thing that is happening to us, how can we deal with it? Who can we seek support from, etc.? So I won't say much. I want to indulge all of us to be very interactive. I believe our resource persons will take time off, tell us, give us the facts, let us know what remedies there are available to us, and then we also can share our experiences. And like Dr. Asa said, this is quite sensitive, so I will implore all of us to give it that needed, so that when people are talking, allow them, let them express themselves. Don't judge them, I would say, and let us not share people's experiences out of this forum without their permission. So I'll encourage us all to be very proactive in this, be interactive, ask questions, feel free, and enjoy the session. Thank you very much, Dr. Arthur.
Thank you very much, Dr. Emisa, for that brief welcome address. I think we are out of time, so I understand. Yeah, so by way of introduction of our facilitators today, we have experts in academia and in practice who would help us understand the issue at hand. Sexual anxiety, its implications on mental health, and the coping strategies we do. It affects male and it affects female. And so we have two females. And ideally, actually, we'd plan to have two males, which is Prof and Seth, but Prof has an engagement, just like Dr. Misa said, so he will not be part. So will be gender bias in this case. We have two females and one male, but I trust that justice will be done to the issue. So our first facilitator is Ms. W. Abna Fusia. She is a clinical psychologist, a lecturer at the Holistic Counseling and Training Consults. Ms. Abna, you are welcome.
Thank you, Dr. It's a pleasure to be here to discuss such an important topic that affects us all.
Thank you very much. Fantastic. Our next facilitator is Mr. Seth Mausi Asafo. He is also a clinical psychologist and a lecturer at the Department of Psychiatry in the University of Ghana Medical School. Seth, you are welcome.
Thank you very much, Doc. I'm happy to have this opportunity.
Good. And the third and final facilitator is Dr. Ama Buedu. She's the Deputy Director of Mental Health at the Ghana Health Service. Ama, are you there? Hello, Dr. Buedu.
Sorry, I hadn't unmuted myself. So
that's
good
right.
afternoon to us all. I'm also happy to be part of the discussion. Thank you.
Good, good. Now that all my facilitators are here, straight into action. I want us to understand 3 key issues here. One is sexual anxiety, one is sexual coercion, and one is sexual violence. These terms, you'll be using them while the discussion is going on. So I want us all to understand. So Seth, take sexual anxiety, Amma take coercion, and Fosua take violence. So Seth, you have the floor now.
Okay, thank you very much, Doc. So when we talk about sexual anxiety, it has to do with any form of fear or feelings of unsettlement that affects the totality of sex. And that could be before sex, during sex, or even after sex. So that's very important. I mean, most of the time, we say that, oh, but it's done. So what kind of anxiety may arise after the activity is done? Now, you'll notice that fear as a concept has a way of affecting the human response to sex in a very significant way. So, and women and men experience it quite differently. In many instances, sexual anxiety in men may show in one, their inability to get an erection. It may also show in their not being able to hold an erection. And then finally, it may also show in feelings of guilt after they have been engaged in an act of sex, or what we call coitus. Now, for women, it could equally show also in the lack of energy to want to initiate in a sexual activity. It could be in the lack of enjoyment. It could show in ways of feeling pain during the activity. And equally, after the activity is done, feelings of shame and guilt. So like the word anxiety and sex come together, it is the fear that surrounds being able to have willful and have to engage in the act of sex willfully, and to see it to an expected end where the benefits are seen and there are no feelings of guilt or unsettlement that follows it. So in a nutshell, that's what sexual anxiety is. Performance has to do with the concept of being able to perform in the act of sex without any fears or challenges.
All right, thank you very much. Madam Fosua, please take it up with the sexual coercion. So you can link it up as is explained with the sexual anxiety. You can link it up.
Okay, thank you, Doc. Sexual coercion has to do with now comes to varying forms of disease or psychological intimidation or threat to get an individual to engage in some form of sexual activity without the person would not have done otherwise. The interesting difference between coercion and outright violence is that with coercion, it's almost like you are made to feel that you have to do something, that you have to perform, be engaged in that act. And then it's also such that you cannot even report it as sexual abuse or sexual violence, but it is sexual abuse. And it can result in a lot of psychological and emotional issues for the person who has gone through such an experience, which can lead to a lot of anxiety and self-esteem issues as in, did I even do it? And especially for the women, when we find ourselves in such a situation, instead of being confident enough to even talk about it, be able to seek help, you are rather burdened with the shame of covering up an abuse so that you will not be judged for it. You put yourself in that situation. And it's a traumatic event.
So that in a boyfriend girlfriend relationship, if you don't love me, you're not having sex with me because you don't love me. So I use that strategy.
Because you don't love me. Because you don't love me. Everybody is doing it, even in the office. And I'm being so nice to you and you don't want to reciprocate. And even you see, even this position, it's even vacant at the moment. It's so subtle, more like a psychological game. It's so subtle that you sort of can't really explain it to somebody else. So the issue of coercion is so deal with that, because it's something that I cannot go to the police and say, I was coerced. How were you coerced?
Okay.
Even the proof of proving it becomes another issue.
More or less like in a nice way, trying to extract sex from you when you are not ready to, when you are not ready to do it.
When you are not ready, or you would not have done it if you had been given the choice. But then you are certainly directed, put in that area, so you are not even sure whether I did it because I wanted to.
Okay.
It's a very, very subtle form of sexual abuse.
Okay. Thank you very much on that. Thank you very much. Dr. Boadu, are you there?
Yes, I'm here.
All right. So sexual violence.
Okay, so thank you once again. So like Foshia said, sexual violence and then sexual coercion are very much similar. The issue with sexual violence is the fact that the individual engages in the act without his or her consent. A lot of times we think that females are victims, but males are not. But sexual violence can occur in both ways, but it's most commonly in, how do you call it? Females are victims. So there is the lack of consent, and it can take various forms. So rape, child abuse, it can take place outside a relationship, even within a marriage. Sexual violence can happen. And then stalking where somebody chases you around, spying on you all over, is a form of sexual violence. And it's very, very common. So it's important that we have an opportunity to discuss it, because it has a lot of negative impacts on the lives of individuals, especially as we are mental health professionals. It's very important for our mental health to be able to discuss this here.
All right, thank you. So to continue from where you just ended, you have a visitor. Hello, young man. How are you today?
That's my son,
your bodyguard. Interesting. So, Dr. Boadu, like I was saying, tell us, trying to link sexual anxiety, of what importance is a good, healthy relationship, a good, healthy sexual relationship for couples and partners. If there is that importance, how is it linked to underscore the importance of understanding sexual anxiety as we are discussing? Please unmute yourself. Dr. Boadu, please, I think you need to solve the domestic problem there, then you come back.
Yes, that is. I need to sort this thing now. Thank you very much.
Okay. Fosia, are you there?
Yes, Doc, I'm here.
Please talk about the question that I just posed to Dr. Boadu. I'm saying that of what importance is a healthy sexual relation to couples and partners? If it is of importance, how does it underscore the need for us to understand sexual anxiety as not helpful to that relationship?
Okay, so we are sexual beings. As human beings, we are sexual beings from birth. Research shows that the male child will get his first erection possibly within the first hour of birth, and then the female will get a lubrication within 24 hours, which means that by nature we are sexual beings. Fortunately or unfortunately, we do not, sex is not a topic that you would normally discuss at dinner. It's not considered polite However, it's very, very essential to us as human beings, because as I've already said, we are sexual beings. Within the confines of a relationship, sex, there are so many benefits of sex, both to us physically and then mentally. It promotes bonding, which is vital for any relationship. It helps improve your self-confidence. It could help you connect with your own body in pleasurable ways. And then when you are in a safe relationship, sex increases the intimacy. So if such a beautiful natural aspect of us is shrouded in anxiety because of some issues that we are dealing with, we are not only losing out on all these benefits, but then we are also, the interesting thing about sexual anxiety is when the anxiety sets in, which would interfere with you enjoying a normal sexual relationship with your partner. It also brings along with it the anxiety that, okay, I already have anxiety, so I did not perform well. So the next time, even the thought of it scares me, which intensifies our anxiety state. Then again, if I'm in a relationship and then coming home, the idea that you might be there and you might be I am not comfortable around you. When you're supposed to be that person that when I come home from the office, or when I come out from town, you're that person that I'm able to connect with, to be able to share my day with. And remember, sex is the only thing that sets us as a couple apart from our other friends. So a healthy sexual life is very, very important to even the way we if you're happy, if you're having enough sex, you're releasing all these feel good hormones, all the oxytocins or all the endorphins, you even see that you grow different. You grow different, and you're even in a better position to deal with the stresses that you might face outside. But then if there's already this sexual frustration at home, either out of fear that I might not be able to perform, or out of fear that even when I started, I will not gain any benefits or any pleasure for it, so it's not really not worth my time. Then I'm already in a frustrated state of mind, which will increase not only my sexual anxiety, but my anxiety levels in relation to other things as well.
Thank you. Wow. So that makes that what we are discussing is very important, because if that anxiety is there, it would not let you get yourself into that space for you to enjoy it and get the benefits that you want. So for a woman would not want to engage herself in it. A man, he also not want to engage herself in it. If they engage herself in it, there is that sort of pretense to be part of it just to satisfy.
Exactly.
Okay, fantastic.
For women, example, I would avoid the situation. We try to avoid it. Or in the other sense,
when you have headaches,
we use the headache, or you close your eyes. It's your wifely duty. So you close your eyes and you be reciting the Psalms in your head, and you just be performing the act, which is also not healthy, because eventually your partner will also pick up on that vibe, and it can bring a lot of issues. Because if I'm not feeling this at home, then if you also start requesting for it, it also leads to other issues. Okay, now he's not coming, is he getting it somewhere else? So it's very, very important that we discuss sex and sexual issues. For me as a woman, I think even though sex is not a dinner table topic, the issue of female sexuality is even more of a taboo, where we are supposed to be the godly, we are not supposed to behave in such ways. Those areas are for the men, because a man is more, so we even give room to more men, male sexual express. But then for me as a woman, so I will close my eyes, recite the psalm, and then perform my wifely duty. Or I will try and avoid the situation if possible. If I can't avoid it, it's possible that when I see you and it's getting dark, I'll start getting tiny panic attacks, because, oh my God, it's getting dark and I have to go and lie beside this man. So it's a very, very relevant issue. that needs to be looked at.
Okay, thank you very much. Thank you very much. So based on that, I think that it's about time we know what are the premeditating causes or the factors that pushes somebody into this anxiety. Let me get the male perspective from Seth, then I'll come back to you, man, to tell me the female perspective. Seth, are you there?
Yes, I am.
Seth, so give me the male perspective. What are the premeditating factors that gets a man into that space of sexual anxiety?
So, I mean, it's always an interesting thing to look at, that essentially when it comes to the act of performing sex, men are overly concerned with how well did I do, as it were. Now, that question in itself spurs up a lot of anxiety in many men, because essentially, even before they act, they have marked themselves in degrees of how well they'll do. So typically, you'll notice that sexual anxiety can be brought about by many different things, okay? You have social roles that explain or demarcate what a man's performance should be like. And this is getting worse with time as technology increases and we have more knowledge about sexual activity, etc. Now, typically within my clinics, I notice that one of the biggest challenges that affect men, or that seems to bring about sexual anxiety, is the sexual organ in question. So many men are looking at their sexual organ, especially if they have a way to compare, and they're asking if it is enough to do the job. Now, if you look at what goes on around us in many media outreaches, you're getting information how to make it bigger, longer, better, what to take to be a horse, all these metaphors that we make in relation. So there's already a social pressure that is put on a person to initiate the activity in the first place. So that fear of, would I be able to match, is a big deal. Now, I also noticed that consistently watching pornogaphy has become one of the challenges as well, because the ideal comparison you're getting is a bit is staged or is simulated. But men actually do believe that it's something that a man should be able to have sex for X number of minutes. I mean, for the information and for the science, it's in a range of 5 minutes really for penetrative sex. So it's important that we get that out there. So that fear is caused. Then you're also looking at the internal issues of, during the process, people are asking questions. Would I be able to hold it enough? How long am I coming? And sometimes it results from prior sexual experience where perhaps a man has not performed to the expectation. Now, you'll notice very practically that lots of people that tend to ask questions like, they ask those questions, did you enjoy it? Did you like it? They usually are doing that to measure how they performed. So what normally makes it difficult, or what pushes people to experience sexual anxiety, is usually a mindset of what they're expected to do as against what they should actually be able to do. Let's not forget that sometimes also you can have biological conditions that affect the male reproductive system. And the way I normally look at it is to ask the questions of, if you wake up in the morning, do you get an erection? In fact, if you do get an erection, then that tells me that the system works just fine. And so then the psychological part comes in when you notice that you do get an erection, but when it's time to perform, suddenly you're losing it, or you're losing the energy to want to go into the activity. And also we can have situational variables of prior negative experiences. So I've had somebody who got an aversion to sex because his very first experience included some order from the female. And so his mindset then became, that's all it is. And he just, is unable to get himself into the mood. So these are some of the things from the male perspective that may, push people, may cause people to experience sexual anxiety.
Thank you very much. So basically, there is a social factor, there's a psychological factor, and there's the biological factor.
Exactly.
And sometimes what about the performance rating from the partner the female partner herself, which pushes the man into questioning himself. That I mean, we've all heard on TV now, they call it 2 minutes.
Exactly.
They call it 2 minutes, that sort of thing. Anyway, as it gets interesting now, we will get back to it. But ladies and gentlemen, feel free to share your comments or ask any questions. I'll pick it up and ask our facilitators as we go along. No comments are coming, but let me announce that. So let's get the female perspective. Amma, Dr. Boyd, are you there?
Yes, I'm here.
So from the female perspective, yes, go ahead.
Okay. So again, I would want to say that the risk factors or the causes are very much similar when it comes to both males and females, with very just some differences, very minute differences. So for females, yes, again, the issue about body image is very, very important. So if I am not confident in my body, then it becomes difficult for me to be able to engage in sex and enjoy it. It comes with a lot of anxiety, because already, if I don't even appreciate my body, how sure am I that the other partner is going to appreciate my body? So that causes a lot of anxiety. And then in females, just like the males, a previous experience, a very bad experience, could also cause a lot of anxiety for sex. So if the individual has been raped before, for instance, very traumatic experiences, then it causes a lot of anxiety. Very importantly, unresolved conflicts or challenges in the relationship can pose a lot of anxiety when it comes to sex. So it's very important that when there are issues in the relationship, we deal with the issues so that we can enjoy ourselves. Otherwise, then it brings about a lot of the anxiety. Yes, medical conditions and even mental health conditions, like he has also already mentioned. So if somebody is suffering from depression in itself, for instance, lowers the individual's interest or libido for sex. So that is another thing. Some medications that we even use in the treatment of chronic, chronic medical conditions, and even the antidepressants that is used in managing depression itself can also cause some form, decrease one's desire for sex, and so brings about a lot of anxiety. Then for females also, yes, pornography, consuming a lot of pornography can actually be a cause. So the risk factors or the causes are very, very similar. Not to forget that stress, any form of stress that we don't deal with can actually bring on a lot of sexual anxiety in both males and females. I'm not sure if Seb mentioned substances, alcohol and the other substances. They all have a way of bringing about sexual anxiety in both males and females. Yeah, thank you.
Wow. Until now, more than I have not had no one and a home and a far, and no crap on it to me put two appetites and off.
Paper.
Then substances, stress, pornography, and all that. Interesting. For sure, would you like to add something from the female perspective? Oh, Amma has said all.
Yes. Has said all, but then I can also add that sometimes partner incompatibility can also cause sexual anxiety in women.
Oh, for sure.
Dr. Can I add one more?
Okay, yes, please sorry. Go ahead.
And then
so sorry.
That's okay. I was adding fear of intimacy and partner incompatibility. causing sexual anxiety.
Partner incompatibility. Okay.
Yes.
Okay.
So if someone doesn't feel
Okay.
comfortable as access to their partner, it's a huge damper on their desire for sex, which increases their anxiety and thinking about it.
Is this physical incompatibility or sexual incompatibility after getting into the relationship?
Physical incompatibility. Sometimes my marriage is arranged. It happens, especially in arranged marriages. So I don't feel comfortable, like with the situation of the child died. I'm talking from the female perspective, where the marriage is arranged, and then you have a young girl being married to an elderly woman. It causes a lot of anxiety for us as women.
So I also think that marriage of convenience, and also to me, causes anxiety.
Yes, it does. So we are married because of something else other than because attraction, physical and attraction, and then friendship is very, very important. Plays a very, very important role in our sex life as well. So sometimes, even though, well, with work it improves, but then it also causes sexual anxiety.
I see. So with this premeditating factors for both males and females, I think that a whole lot of issues, yes, the social, the biological, the psychological, substance use and all that, we need to be careful about all that. Ladies and gentlemen, I think that somebody is picking the questions and your comments for me, so I'll be happy if you make it to everyone. There's nothing wrong sending your question for everybody to read so that you will know that I've answered or responded to your comments. If it's direct, I have a problem reading it from here. Okay, so now that we know the premeditating factors, how does it finally affect our mental health and our quality of life? Because definitely, I think you've chipped in a few instances how it affects it, but let's be clear on that. Let's pick the male perspective. I'm not being biased, where I always want the male perspective first. No wahala for me, I beg you. Let's pick the male perspective first, how it affects our mental health and our quality of life. We'll look at it from three angles: the male perspective mental health, the female perspective mental health, and the couple situation, how it affects the couple, the health of the couple. So we'll look at it. So Seth, give us the male, how it affects the quality of life of the male as well as the mental health and all that.
Okay, so very interestingly, if you look at especially and I always like to talk about sex and sexuality within context, and this time I want to talk about it from the cultural context of what it means to be male or to be masculine. Okay, let's look at what the reasons, the typical reasons for engaging in sexual activity have been, which are usually for procreation, for, of course, pleasure. And of course, there are some very other funny and interesting ones like punishment, etc., etc. Now, let's look at it from the masculine perspective. Now, men's masculinity is directly tied with the ability to, one, be virile. So they're able to have children. And if you're to have children, you must be able to engage in the act of sex. So you must be able to hold your erection enough to ejaculate. Now, sometimes because it prevents you from being able to hold an erection, that also equally means that you may not be able to. And if you take specifically a condition like erectile dysfunction, where you are not able to get it hard enough to engage in a full act of coitus, then you can imagine what it means to the person's masculinity. Now, secondly, if you look at it from the perspective of not being able to do the process enough for your other partner to, as it were, enjoy or be satisfied, then it directly ties into your ego as well. And all these little things, what they do is that they cause a stressor within you, or they build up an initial stress. Now, the stress in itself can be problematic, and the indirect effects of the stressor can equally be problematic. So like Dr. Boyd mentioned, we typically know that when it comes to mental health, many of the triggers for mental health conditions are stress-based. Okay, so we might all have noticed somebody who suddenly lost a loved one, and then they lost their mind, or somebody who lost their job and they took to drinking. And these are very specific to explain that stress can push somebody who has a predisposition to mental health conditions. That's the base of what I'm saying, the foundation. So if you look at it from that perspective, then it makes sense. It makes sense to say that whenever I feel that I am unable to perform sexually, beyond all the benefits that it has, which is one, it helps to lower the heart rate. It helps to reduce the amount of stress hormones, which is cortisol, which puts you in a better mood, boosts your immune system, increases endorphins. All those benefits are there that you are not able to access. And then you are getting on more challenges because your body and your mind go into an alarm mode. It goes into a stressful mode. And of course, getting an erection during a time where you have a lion at your heels is not particularly adaptive. So if we want to look at stress in essence is
and
like—
who is the lion here?
This would be a normal lion. I'm trying to make an analogy.
Okay.
That says that your inability to engage is one because your mind, when you are stressed, says you are in danger. So regardless of what kind of stress it is, which is the fact that you are afraid you may not be able to do it well, or you are afraid of what might be said when you are done, the mind still reacts to it as if you were in a danger, a fatal kind of danger. So if you are in a danger, it's not the time you are even processing to engage in sex. Is what I'm trying to explain. And in the same way, that stressor becomes a basis for many other anxieties to fuel, which equally can trigger more significant mental health conditions. Now, if you are in a relationship and then you perhaps have a performance anxiety and your partner is constantly on the issue, Onya Bema, you are not even a man. Now, if you see the kind of pressure that's put on you. So you are anxious at one phase because maybe you're not even able to come home for the fear that you might be called names. And in the same way, you are having all these disconcerting emotions, which can predispose you into a depression, which further reduces your libido. So then you have a series of reactions that are occurring that makes it even more precarious. So you are not getting the benefits of engaging. You are afraid. And then you are now getting on many negatives that equally makes it difficult for you to initiate. So it's almost like in a downward spiral and you keep going and it seems like there is no savior anywhere.
This one is hard for men, pal. This one is hard for men, pal. Let's see if it's hard like that for the women. Let's see if it's hard like that for the women. Fosia, what is it for the women?
Dr. Asa, a lot of the issues that stress raised.
How does it affect your mental health? How does sexual anxiety affect your mental health and quality of life?
Sexual anxiety. Hello, can you hear me?
Yes, I can hear you.
Can you hear me? Yes. All the issues that stress raised about stress and it's linked to mental health and sexual anxiety, we also experience it in the same way. For women, let me speak in directly from a woman's perspective. Sexual anxiety can affect us at any stage of the sexual response cycle. Okay. And some have that, which is not the same for men. Women tend to have more desire issues. So I don't feel like this because unlike our male counterparts who are moved by sight, for us, to even get into the mood to have sex in the first place, you need to sort of work us into it. to go back into it. So a lot of the time, we don't feel like it. And then when you give birth to, like after birth, you're dealing with all these other issues, all the hormones going around the place. So we don't feel like it. But then men are moved by sight, and they need us because the sexual response is part of us, our sexual response cycle. So he comes to you, I don't feel like it, and then for us as a woman, when you keep saying I don't feel like it, you also start feeling it. But why am I always like this? So you try to perform. And interestingly enough, when it has to do with excitement, and because we are so worked up, we can't relax. So the vaginal walls are not dilating enough to allow pleasure. I'm feeling the pain. But then sometimes our interpretation of feeling the pain is not always the same way that our husband or our male partner see it. So when people struggling with sexual anxiety, or if you also experience some negative and physical emotions, whether before, during, or after, or sometimes, as I said earlier, I get into the act, and I know that you will be able, the man will reach orgasm resolution, and then maybe I'm now at plateau. So the act itself, I find no pleasure in it. I'm already tired. We come home. I've dealt with all our other duties and I have to perform them. And then you are not taking me there. So it becomes frustration. I get frustrated. Otherwise, I'm talking about every day, every life, everyday issues. And as I said, because sexual response is also part of our natural, it's part of us. There are times when I would also like to have sex, but I know that engaging in it will not be profitable to me. So there becomes all these feelings of frustration that I have to hold in.
The word profitable, as if it's business. Meanwhile, it's not business.
Well, what I'm trying to say is you will orgasm achieve full resolution, you're falling off to sleep, and I'm left hanging in the air. So in that sense, it's not profitable for me. It's not profitable for me. And what leads to depression? What leads to sexual frustration? Leads to depression for me because I'm always hanging. How do I address this? Unfortunately, when you come out, you'll be told, oh, as a woman, pray about it. We are told more often as women to be able to deal with these issues underground.
Okay. Okay, so the frustration affects your mental health as well as the stress in there. Let Amma top it up. Let Amma top it up. Let Amma top it up. Dr. Bodu.
Okay, yes, please. So I agree very much with Foshia. A lot of times in our setting, it is expected that for a female, you don't talk about sex at all. Yours is just to conform. But we are all human beings. When God created human beings, he created them both males and females. And therefore, whatever he put in the male, he put in the female. So for females, a continuous anxiety sort of perpetuates it. So for instance, like Seth said, if the male is not too sure how he is going to be rated by his performance, then the next time it's going to be the same issue. It's the same with females. But it looks as if for a female, like what you are saying, I will just conform. It becomes like a chore. I will just lie down for you to do whatever you want to do. But sex has its own benefits for both males and females, and nobody should be denied that. I also want us to look at it from this perspective. Talking about the risk factors or the causes of sexual anxiety in both males and females. One that comes up very much is the issue with body image. So I am not confident in myself, okay? I do not appreciate my body as it is. And some people will be looking for validation from another person, which shouldn't be. So if it is not dealt with, the individual moves on, is dealing with this. I'm not too sure about it. It causes a lot of anxiety. And then this will tip the person into depression because it's a problem that is persistent and it's not being resolved. Eventually, we have had people, kill themselves, as in they die by suicide because of the issue of sexual anxiety. So it's very much like it is in the males. I mean, women also have similar experiences and it impacts negatively on our physical, on our emotional, mental health. And so I'm happy that we are asking, both sides to the issue so that nobody feels like Fosia said, there's no benefit to it, but it should be of mutual benefit. Yes. So that is the little that I would want to add to.
Good. So that anxiety from the female perspective, whether it's body image, whether it's abuse or it's stress, it affects the excitement or the profit that she will get. So when profit reduces, the company will collapse. Therefore, that affects the mental health. In fact, it is critical. What for me, I know we'll get to the point whereby you would profess effective strategies of dealing with this. Effective strategies of dealing with it. So I'm happy that we'll get to that point so that we can help ourselves to deal with it. Now we know, at this point, we know that it's an issue that some of us are dealing with. It's not helping. It's not profitable. It's affecting their stress level. It's worsening it, their day-to-day lives and all that. Okay. Now, should I say there are common known remedies that both males and female use? For the females, I know this, I have headache, I'm tired, and all that. The increase in alcoholic beverages with very dangerous names are all there. Let me leave that to you. So again, I always want to start from the male perspective. So Seth, what are the common inappropriate, because I want us to come to the appropriate. What are the common inappropriate remedies that we resort to deal with this sexual anxiety? Charlie, 2 minutes, no matter radio society, well, 2 minutes, 2 minutes, but it's a problem. You be deal tops. So you have to go and hire a lawyer to chop your matter for you.
Yeah.
But anyway, you tell us, you are the professional, you see the issues in the consulting room. So tell us, what are your experiences?
Well, I mean, there are avoidance ways that people use. So that would include staying long hours at work, trying and doing everything extremely possible not to be within the home setting or around their partner.
Oh, no. So are you saying that the workaholics have a problem or something?
No, these are not workaholics. It's not that they have work to do. They are intentionally staying at work.
But somebody is busy at work, a lawyer at work, working so many hours. You are tempted with this. Somebody will tend to conclude.
Yes, you can't neglect all the facets of your life. Okay. And so if you are taking care of everything apart from your sexual health, then I would say that that's maladaptive. And these people have that specific goal that I know my wife will be asleep by 10. So what I do, or my partner is asleep by 10. So I stay at work, I work, and I come home at 11, she's asleep, and I'm out by 5 a.m., okay? Sometimes it becomes little bouts of aggression. So the least thing that happens, you flare up. And of course, with males, we're actually socialized to show some of these negative emotions like aggression and all of that, which equally means that we're not in a good mental space. And so once we are not happy with each other, I get my time off. Now, I've worked with couples, and I've noticed that specifically there are instances where a man or a woman would intentionally provoke their partners, because once they are provoked and they are not in the same place emotionally, they don't have to have sex. So these are the avoidance behaviors that you'll notice. Then you also notice people trying to take charge, but obviously maladaptively. Now, in my clinic, one thing I have that shows very significantly is many men who have performance anxiety issues tend to talk about it with some trusted person. And the advice, although being cultural, would be if you really have it, go and try it outside, because just your wife may be the reason. So then it starts to bring about many complications as people go outside, and that causes another level of stress. Then you find that the use of sexual enhancers. So in, I think, 2011, I conducted a study to understand why males use sexual enhancers. Now it's pathetic that whereas we expected that more adult males would use sexual enhancers, you're getting teenagers, young adults equally using sexual enhancers, which are interesting because then it tells you that the pressure to perform is significantly increasing. And so people will then use, as it were, focused approaches like getting sprays or drinks or whatever that purport to allow them to be able to hold their erection for X amount of time. In my study, for example, one thing I noticed was there was a particular medication, which is an antipsychotic medication, and it has a side effect of inhibiting ejaculation. Now, it is one of the most abused supposed sexual enhancers, even though it's not. And people don't really care about the impact it has on them because they are so concerned about, I must be able to pound, I must be able to pound, I must be able to pound. So what I see dominantly is avoidance behaviors, which is stay away as much as you can, show emotions that makes it difficult for your partner to request it, predominantly. And then sometimes people try to use other approaches. So they'll avoid this, but they'll be engaged in active pornography watching and masturbation because they need to get off or they need to get their sexual desires fulfilled. And then the brain now tends to learn that since I can do it this way, there's no need to do it with my partner. And then neglect brings about even more complicated issues going forward.
Wow. Well, I have a few comments here from Sarah Forrest. She says, maybe females should organize master classes to learn from sexual therapists. Fosia and Amma, be ready. A very educative and insightful topic from Jonathan Odame. Dr. Odame, okay. Rumesha too, but please, how long can a man stay without sex? Seth, how long can a man stay without sex?
We have, sex, in as much as we say that sex is a basic need, okay? You won't die without having sex.
I have an interesting comment from Sarah Ofori again. It says, as women aging and age restriction on sexual excitement and styles puts the men off. The woman is old and she can't do certain things, so it puts the men off. We men are more acrobatic, so interesting.
I disagree.
You disagree, eh? Yeah. Okay, so Sarah, Seth disagrees with that point. Adwa Mensima also says, very interesting and educative discussion, which must be extended to the church to save a lot of those facing such a challenge. Great job, organizers and facilitators. Thank you, Adwa. Dossi also asked, do medical professionals educate patients about side effects of psychotropic medications prior to prescribing them? That one, even though I'm not a prescriber, I know that they do. Dossi, I know that they do. And Seth, this question is another serious question that I think you should answer before we go on.
Okay.
Is it normal to have sex for over 40 minutes and still not reach orgasm for male, please? It has been a concern to my partner. She feels I am sick going that way and sometimes suspects that I was on drugs. But frankly, I don't. any help to the question? So the 40 minutes, is it normal or it's not normal?
Well, I'm not going to look at it in terms of the duration, okay? But I'm going to look at it in terms of the inability to reach orgasm. Now, if you look at the sexual response, we want to be sure that, first of all, you have the desire to have sex. It's part of the normal sexual health, okay? We want to be sure that you can get excited, which means that you can get an erection for men, and in women, you can be lubricated enough to be, engaged within the act of coitus. And then finally, we want to be sure that you are able to orgasm, or you are able to feel the extremities of the activity. So if perhaps, and so we notice how sexual health issues or disorders are located within either the facet of desire, excitement, or the orgasm. So if you are doing this, it's not the duration. If you can orgasm, I'm not worried. But if you're doing it so much and you are not still being able to orgasm, then perhaps we need to talk about this a bit more. Yeah.
Okay, so Fosia, do you share the same concerns as this man's wife, partner? 40 minutes without orgasm. Do you share the same concerns?
Yes, Dr. Alpha, I do. 40 minutes continuous without orgasm. So does the orgasm occur after 40 minutes, or is it going to last an hour? For me personally, I think that there might be an issue that needs to be looked at medically. Maybe the person accepted, maybe the person is having problems with orgasm, which could be a medical condition. Condition. So for me as a woman, 40 minutes straight, Dr. Asa. Even though women are supposed to be able to get more successive orgasms than men, to go 40 minutes at a stretch, I think is quite a bit.
Okay. Mr. Hanu, your question I think have been discussed already, sexual anxiety and performance anxiety. What is the difference? I think it has been discussed. I think that I like Galaxy A11. What an interesting name. That is your name. Can abstaining from sex for too long affect a guy's health? I don't think it does. And can you answer Roman fathers in communion?
If abstaining is your own choice, then we say that's fine. But if you're abstaining as a result of something, which is performance anxiety or some underlying physiological issue, then that's problematic. So the context is always very important.
Okay, an interesting question. Sarah, that will be the last one from you. You've exhausted your limit. A partner tells, because you can't twerk, or maybe waist pain or knee pain, you are unable to engage in certain styles, and this don't get them excited. Sarah, this is not, I don't get your question. Sorry about that. Albert, I think longer refractory period can also lead to sexual anxiety, but I want to know the normal refractory period or duration. Okay, so who is going to take that? Amma or Seth? Amma, are you there?
Okay. So I think that there isn't any established normal duration of the refractory period. It varies from one individual to the other. For some people, it could be minutes. For some people, it could take an hour. For some people, it could take a day. So again, as we would always say in mental health, is it a deviation from the person's usual or normal life? When that is it, then you would want to find out what exactly has changed. So how is it affecting the individual? Is it persistent? So you would want to look at all these things, especially when it comes to those one, if it's a deviation from what the person usually has been. But there isn't any right or established duration or normal duration for the refractory period. It varies from one individual to the other.
Okay, so to refresh our memory, the science mentioned, let us understand that for men, some men who are experiencing sexual anxiety, they use avoidance and being a little bit aggressive as a coping mechanism. Now, what about our females? At least I know they're typified at the end of the week. And then my bread,
So I think that I was very happy with Seth's submission because he explains it all. It's same for women. You have heard it, but if we have an opportunity, let's talk about it. Like my sister said, if the sexual engagement is non-beneficial to me, I will certainly avoid it. Because for us, it's a lot of, it takes a lot for a woman to engage in the sexual activity. And if it's all about satisfying my partner all the time, let's remember that once a while, if you have, these issues, is normal. Sex is not always perfect. But if constantly or persistently it's been an issue, then you need to seek help. So if I am not enjoying it and it always comes as a chore, a duty, then I'm going to avoid it. And that is why we will come up with all the excuses. We would say it here, yeah. We would say we'll use the children. Yes, we'll use the children and work, house chores and all that. So that is one way would also, a maladaptive way of dealing with it. We would also do pornography. Yes, females also do pornography. Females would do masturbation. Females would, the alcohol and all the other things that the men use. So there isn't much a difference. So again, I am happy we are discussing this issue from both male and female side, because a lot of times it is assumed that for a female, probably until recently, for a female, all you needed to do was to, just satisfy your other partner, but it shouldn't be so. So we'll use the same maladaptive strategies just as the men would use.
Thank you. I have a question here for all of you. In your consulting room, has the issue of size become a matter? So one, Mr. Hanu is asking, does the size matter? Some women say the bigger the better. In your consulting room, have you come across that issue?
Dr. The issue of size seems to constantly flood, therapy when it comes to sex. And I'm going to say it again. It doesn't really matter. The reason is this. Depending on your size, there are still things that you can do to ensure that you have fulfilling sex. That's what you must understand. There are positions that you can assume that can make you smaller and therefore make whatever size it is seem bigger. Okay? There are positions that can make penetration a bit more deeper to get to where you are supposed to get to if you are that kind of person. Interestingly, lots of people also complain about the fact that when it's too big, it starts to hurt. And so there's no pleasure in it. So I'm always trying to explain it from the perspective of skill and knowing that we can all cultivate the skill. Now, if we look at it from simple biology, then it means that anybody who has a smaller sexual organ should not be part of the process. But a skill is something you can learn. You are not endowed with it. So when you typically look about sex and performance, it's as a result of skill and not because of an endowment. That is skill, what I was.
Skill, okay.
But the porno they are looking at is giving them unrealistic expectations. You see, so that is the other problem. If you look at many of these, you can watch porn that's 2 hours and one person is pounding for a whole 2 hours. No, these people are using drugs. Sometimes they stage a part of it. They do one, they come and do later. And you perhaps look at it that way. Like I was explaining, when it comes to the average of penetrating, holding an erection to to complete penetration. It's a range of between 5 plus or minus 30 seconds. That's where the range is. And this is not me saying, this is what the fact is. So it's not really.
What we manage, if you're able to manage that 5 minutes, then it's about passing 100%.
Then it means you are functioning normally. But there are variations in your partner. You see, men are like a petrol engine. So we move very quickly. Women, on the other hand, are like a diesel engine. So you need to work them up into the mood. So I tell people that the most important thing in sexual interaction is actually the foreplay. It's trying to get your partner to the same wavelength as you, or else if you're ahead of them, obviously one will get to go before the other. So the context is important, knowing who you're working with and being able to synchronize with them. Not so easy to do, but it's important that you work your partner up to a place where both of you can start the action of penetration. Not that you are so concerned about the beginning, I just want to penetrate. Definitely, you're not going to be helping your partner if that's what is happening always.
Thank you very much. Now said, very well said. Porn is fake. I think I also agree. I've known that. Albert Edijenfi, I think your point has just been discussed. So I think that we'll go on. So at this point, let's get to the real effective remedies that we can use to help ourselves before we come back to our audience, what other questions that they do have. So let me start with you. What are the real current effective remedies to deal with sexual anxiety in females? Looking at all this headache, body image, stress, and all that, don't you know? But me, I can't be and so what are the effective remedies or coping strategies that we can use to do with it?
So communication is important. Communication. As a couple, we need to be able to create that haven where I feel comfortable to talk to you about our sexual life, to tell you about the issues that might be affecting us. So if it has to do with past trauma, which is one of the key factors that causes sexual anxiety in females. If it has to do with past trauma, sometimes it helps to be able to deal with the underlying trauma. So you should be able to feel free to talk to your healthcare provider about your sexuality. Our sexuality is nothing to be ashamed of. It is not a taboo. It is part of who we are. So you should be able to talk to your healthcare provider. These are the issues that I am facing. Then maybe the medical conditions can be ruled out. If you have a result of some medications that you are taking, those can be ruled out. And then you can see a counselor, the way you can deal with all the traumas that we are coming with. Sometimes it's even the way our socialization. I had a client come in one day and he said that when he's making love to his wife doesn't let him touch his breast because the wife was told that the breast was for the children and he has no part to play in sex. So sometimes even our socialization have a big role to play. So let us talk to each other. It's very important. You can start in the bedroom. Let me know what you enjoy. As a woman, I should be able to understand my body. I should be able to understand the things I do not like and the things I like and dislike. I should be able to deal with my stresses. More importantly, two of us in a relationship. So what my issues are, I should be able to first and foremost discuss them with my partner. Okay, these are my issues. These are my fears going in. And to be able to enjoy sex, it doesn't necessarily take penetration, as Seth was saying. There's a whole play, is a whole thing. You can build intimacy, build bonding without actual penetration. Sometimes it also helps scheduling stress so that we know that, okay, Tuesday is sex day, but then we work into it. Men move by sight. I like to say that they are automatic cars. You put it in drive and it's gone. But the women, we are like, you have to keep shifting the gears to work us into that position more often. So we build up the excitement, intimate touch, love languages, getting to know each other, nurturing the intimacy, the other areas of the sexual encounter that does not necessarily involve penetrative sex. So that when we build that comfort, when we build that intimacy, it becomes easier for us to open up to penetrative sex. And then again, when it's the painful sex and all that, when you get the medical professionals to rule those things out, the organic medical causes out, then we can seek therapy to deal with maybe past issues that I'm coming with, past experiences, depression, all these things. Sexual anxiety can cause depression. Depression can intensify sexual anxiety. They work hand in hand. So that's what I'm saying. What I would say is that communication between couples is very, very, very important. We need to create a forum where, as women, we are comfortable to talk about our sexuality. We are not just in the relationship to satisfy our male partner or bad, yes. You have to satisfy your husband. I'm also a human being. I also have sexual urges that need to be tackled or needs to be fulfilled. So in a relationship, we should be able to encourage our females to talk openly about sex. Female sexuality is not a taboo. Female sexuality should not be swept under the table. Female sexuality should not be put in the realm of pray about it. We should be able to talk about it. And if we are able to talk about it, then our males will also be in a better position to enjoy us. Because when it becomes mutual, I believe that it facilitates better enjoyment of the process, which is a natural part of all of us.
All right, thank you very much. Well said. I'm still bombarded with a lot of questions here. Ladies and gentlemen, I'll come back to your questions. I just want to achieve the target that we've set for ourselves by getting the real remedies. So please, let's deal with that. And when we still have some time, we'll look at your questions. I'm not ignoring them. Sarah and Nana Kojo, I'm not ignoring your questions, but I want us to deal with the target of the real remedies that we can use to help ourselves. When we are done with that, I'll come back to your comments and other. Amma, do you want to add something to what Fosia said?
Yes, I would like to say that like Seth said in his submission, if you concentrate or you think about sex as a performance, it brings about a lot of anxiety. So if it's a performance, certainly there are people that are going to scrutinize you. So one way to handle this, apart from, well, in addition to what Fosia has stated, is you would have to try to immerse yourself in the experience of sex and not, dwell on, concentrate on the performance. If you do that, it takes away a lot of the anxiety associated with it. So you would want to enjoy sex and then think that, how do you call it, cognitively restructure your thoughts. So instead of concentrating on thinking about the fact that, oh, we're going to have sex and I'm not going to enjoy it as usual, you can, restructure that and say to yourself that today, myself and my partner are going to, enjoy ourselves. And then you work towards it. So you have to learn to do away with the negative thoughts, and it has to be very conscious. Initially, it's going to be a bit challenging, but with practice, it helps. We said that another risk factor or cause is stress. So if we're able to manage our stresses well, it will enhance our sexual life. That's very, very important. And yes, again, for me and for females, a lot of the time, issues have to be resolved. Let's not, just sweep them under the carpet and think that once somebody said, and I've heard a lot of guys say that if you have a problem with your wife, what you do is, and in fact, I heard this at a wedding ceremony where the pastor said that if your wife is angry with you, if you have challenges, catch your wife. This is how she said, and sex her. I mean, we are not objects of sex. We are human beings and have to be treated just like human beings. So it's very important that we consider what our feelings are. And then when somebody or your partner tells you about what his or her feelings are, let us not be selfish. Let us not be selfish. Let us try to understand each other. Together we will grow, and then both of us will enjoy our sexual life, which is very, very important. So thank you very much.
Wow, thank you. That's quite insightful. If you have the issue of sexual anxiety as a problem, now you have some tips to look at. Any of them will help. Now, Seth, from the male perspective, and some of more tone with TV, so the no boys, and I don't want to mention some names. Every alcohol that is being sold on TV has a sexual this thing. But could be the didn't oh, how can alcohol? Anyway, so give us the effective, appropriate remedies that do not have adverse consequences for us.
So, Doc, about alcohol, I just want to put it out there. If you're a male and you use alcohol as a way of enhancing your performance, you're actually doing a disservice to yourself, because the research shows that alcohol actually increases your female hormones, which is estrogen. So you need more testosterone to perform. So be careful where you're using alcohol in that sense. Now, I look at the solutions in terms of the part of the human response where the challenge is. So, for example, I want to give solutions regarding desire. If it has to do with desire could be as a result of a biological issue. It could be a psychological issue. So like Dr. Boydu said, restructuring cognitively the way you think about the sexual activity. Now, we are what we think. And if you think you will not perform, you actually won't perform. Not because you are not capable, because your mind puts a lot of pressure on you that makes it difficult. Think about increasing desire with doing simple things such as exercising, which generally boosts your self-esteem and gives your heart health also more energy to be able to go ahead and do this. To increase desire, you also want to look at hygiene. And that's something that puts a lot of people off. In many of my clinics, I notice how many people have started, they are having aversions to sex because my husband will not bath. He doesn't like bathing, and yet he wants us to go around sex. My husband, my wife doesn't like to brush her teeth, so there's always some odor. The place itself doesn't look neat. So you want to take some steps to ensure that you can increase the hygiene of that place. That makes it more probable that people would like to initiate. Now, let's not forget that when it comes to sex, practice makes permanent, not perfect. So the more you do it, the more it gets better, especially with communication. So we've looked at desire. What are some of the things that you can do to increase excitement? Okay. Now, in my clinics, I tell people that you need to prime your partner. And this is where communication comes in again. How many people would send a message to their wife to say, or their husband to say, tonight, the way I want to have you? You are priming them, okay? Now, what you're doing is that you are taking their mind into many assumptions of what will happen. So during the whole day, they are already ready for the action. So it makes the culmination of actually doing it so perfect. So you want to, and these are all things that you are doing on the mind. Now, when I work with people who have excess performance anxiety, paradoxically, all I tell them to do is sleep on the bed naked, but don't have sex. What I have done is to reduce the performance anxiety. And in many cases, you know what happens? When they sleep, they actually perform because they can't just be there with their wife without having to do it. But then the pressure has been taken off them. So you want to look at the concept of being spontaneous, okay? Spontaneity is something that generally increases excitability within partners. And in many of the researches and interactions with clients, they'll tell you that the best sex they've had is the ones that have been spontaneous. I was cooking in the kitchen, my husband just came in, bum. I was watching television, my wife just came and bum. So you want to look at all these concepts. And then when you have tried your own tips. And I mean, these ones that you can do, like hygiene, priming your partner, restructuring your mind around sex, and also reducing the expectations. So I tell people, stop the porn. Stop looking at porn as the yardstick for measurement when it comes to. Now, in a different way, I also look at the effect of masturbation and the use of sex toys when not used appropriately or in moderation. Because what it does is it makes your partner seem like they are unable to do what these things can do. And if you become responsible for your own climax, you're not going to be interested in enjoying this process with somebody else. So we want to look at all these concepts together. And if it has to do with, if it's a biological issue, you want to look at all of that. Dr. Boedu mentioned that we want to review the kinds of medication that you're on. Maybe it's inhibiting your sexual drive, etc. So when you do what you can't and that it's not helping, you want to seek help and see a professional. Thank you.
Thank you very much. On that score, now, key for both female and male remedy is communication.
Yes.
And therapy.
Yes.
Communication, we need to, as partners, we need to talk and understand each other, be assertive, understand each other. Now, from the therapeutic point of view, I want us to understand the management model that if I come to see you, that I have a problem, I want us also to, I want people to get comfortable to come and see the professional. So give me that picture. What is the management model like, so that I would come and see you and talk about it without being inhibited, with the social stigma.
Yeah, the most important thing you have to know about seeing any professional to help you with sex is that it's a very non-judgmental setting, okay, where you are allowed to talk about all your sexual desires, regardless of how uncomfortable they may seem from so whatever you feel is something that is not trivialized. Now, I'm happy for this, what you are doing. I must commend the Mental Health Authority significantly, because the issue of sex is something we don't talk about, which equally socially makes it difficult for people to come out to discuss things like this. And I give you a typical example of a client I had who from childhood had been socialized to think of, hey, sex is not a good thing. It's bad. So even into their adult life, when they are married, they are always having challenges having sex, because the idea they gave about sex it's become a part and parcel of them. So the communication is not just within the partner relationship, but as a society, it's something that we need to talk about. And when we are talking about it, we need to give valid information, not what some people are doing. They are saying any kind of thing. No, you need people who know, and they are working with the practice and doing the research. So it's a very non-judgmental service. You're allowed to express yourself. And of course, I must say, no therapist will, as part of helping you, touch your breast or your penis, or it is not done. Neither would they suggest anything sexual that must happen with them. No, it's not done. Basically, it's to help you identify why perhaps you're experiencing these things, and together you establish a routine for solving them. Your therapist may suggest things that you do, but your therapist will not tell you, go and get side chick. No, it doesn't work that way. So when people think about it,
no, we work together. We work together.
We have. So because you create an environment where people are comfortable, they can tell you exactly all their pains. And you may sometimes realize that the problem they have is a very simple matter. Like one of my clients' biggest problem was, my partner is not clean. So their hygiene when it comes to the area is terrible. And I cannot tell them because I fear that if I do, it may ruin our relationship. It's as simple as that. So then we arrange a session where we do it together. where the therapist basically gives general cues and says, you don't have to keep the place neat. You have to ensure. So you have sent the message and everybody tries it, and without having to make anybody feel bad that they've called me out on I have bad mouth odor or my public area, my private area is giving off. So it's a very private, confidential service that seeks to empower you to be able to be comfortable, because to enjoy this activity, you must be comfortable. That is the end of the road. Without being comfortable, you can't enjoy the activity. You become during the process. So that is what I'd like to say.
Okay, let me pick your thoughts, Fosia, on that. Then I'll come to Dr. Boedo.
Yes, as I said, sometimes the issues that cause, sometimes they might be minute things like hygiene, or maybe sometimes you just be surprised that I don't like the kind of perfume you use. Can even cause some form of anxiety during sex. But then on the whole, like I said initially, I believe communication is very, very important. I also believe that maybe we need to transfer sexual education back into the curriculum, where we are educating the young ones on sex, the uses and functions of sex, the emotional and psychological aspect that goes with sex. You'll be surprised, Dr. Asha, when I put this flyer out on my DP, I started getting videos and snippets from people about the use and sex these days. So what kind of information are we putting there? What kind of information are we giving our youth that would directly affect their relationships as adults? Now, teenagers, young people have started using sexual enhancers. And even with the sexual enhancers, it's not only for the males. You'll find out that recently there are sexual enhancers on the market for women too. It's supposed to help with lubrication. It's supposed to help increase the sex desire. And these are all very, very dodgy medications. So I believe that education should also go out further, as one of our contributors said. Maybe we need to start engaging the sex. Maybe we need to find ways of putting across the information that it is in a marriage, it is okay to talk about the sexuality. It is okay. If you don't talk about the issue, how do we get it resolved? If you don't talk about the issue, how do you know where the appropriate area is to go and get that help? First, we need to be able to open up and talk about it. So I still believe that communication is very, very, very important. Maybe in that case, we will be able to also put across that there are so many other ways of enjoying ourselves as a couple. That does not necessarily mean that we are going to have penetrative sex. These areas will also help us become comfortable with each other. Even the way I perceive my body image. If we are not seeing all these areas, then perhaps I'll be able to feel good about my body. Tell you, okay, these are the areas that I have issues with. As a woman, if I have some body image issues and there's something I can do about it, then maybe I'll be encouraged. So it's very, very important that in the relationship too, as a couple, between us, we are able to build that environment where talking about sexuality and issues related to sex. Feel comfortable. There are no prohibitions. There's no sense of I'm a woman, so these areas shouldn't be part of my discussion. So I still believe that communication is very, very important. And then enabling, giving out enabling information, whether through premarital sessions, whether in sex activities, we should also be able to put out that information. We should create an avenue where we should be able to talk about our sexuality. In so doing, then we are well informed that, okay, these are the things that are possible, that might happen if I engage in these activities when I am not ready for them. These are the kind of things that contribute to coercion. These are the kind of things that contribute to coercion. And these are the psychological, sociological impact on the individual mental health of state. So that we don't have a lot of people going into relationships and then they are sort of, I'm carrying this wound, I'm carrying this uncertainty, I'm carrying this psychological issues that I am looking up to you to find a way to miraculously get rid of them, because you and I are in some sort of committed relationship. Even that alone can put a lot of pressure on the relationship. So Dr. Atta, I will end with communication. Let's be able to put across the information before it gets to the stage where all these anxieties build up. Thank you.
Fantastic. Dr. Agbodo, professional help. What do you tell our listeners so that they'll be comfortable to come and see you to talk about their sexuality, their sexual anxiety problems?
I think that my co-panelists have said it all. Sexual anxiety is very, very common. In fact, the statistics say that about 25% of males and about 9%, 16% of females, have sexual anxiety. So it's a very, very common experience. But having said that, there are solutions. So there's no need for anybody to, suffer in silence. What it does is for it to, perpetuate, and then it gets worse. And in the end, nobody knows how it's going to be. So I want to say that, just as my co-panelists have said, when you come to us, the setting is such that you'll be very, very comfortable. It's very non-judgmental. In fact, it is like going before God. That is how I'll put it. When you're going before God, you don't have to be afraid, because even before you get there, He knows already. You don't have to pretend. So it is when you come to the right people, of course, because we know that when you fall into the hands of the wrong people, I mean, they make it such that you don't even want to have an encounter with any medical professional on this issue. But if you get in touch with the right people, you can go before them and then be as naked as you can be. Not literally, undressing, but I mean, open up as much as possible. It is when you have been able to open up, because let's remember that the risk factors or the causes are numerous. It is when you have opened up and talked about the issues, that is when someone or the therapist can put a finger on possible causes and then address them appropriately. So let us not be ashamed of it. It is very, very common. A lot of people are experiencing it, and there is help. So let's come on, let's talk about it. And I cannot overemphasize the fact that we need to communicate. We need to communicate. We need to communicate. And I think that what we should also do, apart from talking about, teaching it to the younger ones, because adolescents are engaging in it, but of course we have to be careful how we talk to them about it. And for them, they grow with it. It starts from there. The issue about body image. Let's be confident in our bodies. No matter who or how you look, let us be confident in it. Because, I mean, no matter how you look, there's somebody that appreciates you. That is why nobody knows the color of God. Nobody knows God's complexion or His race. He made all of us, in His own image. And there are different races, isn't it? It's the same when it comes to body image. But we are all a representation of Him. And so let's be confident in ourselves. Let's not allow ourselves, to continue to be coerced or violated or harassed. No, let's look for help, because there's help readily available. Thank you.
Thank you very much. On that score, let me read a few comments starting from the last one. Lady Na, these resource persons are great. Thank you very much, Dr. Atta and the whole crew. Thank you to Lady Na. HP is saying, personal hygiene is so important in partners' sexual lives. This pertains to oral care, vaginal, penis, and pubic hair. We must take all of this very seriously. I like the word very seriously. You can't joke with that. David Edu also says, the goal is to make each other feel good. And many times when there is no pressure or demand for sex, desire and arousal can surface. And when there is good communication, that's very true. Winifred, great delivery. You have solved my problem. Hallelujah, hallelujah, Winifred.
Amen.
Mary and you. Very true about having factual information and safe space to discuss such issues. It is my hope we include experts in such discussions, especially in our churches. That's very true, Mary. At least on this platform, we always bring the experts. And at least if for nothing at all, one person's problem has been solved. So I don't know when you test, I don't know when you test the solution, but I know it will be well. Winifred, Albert, is there a psychotropic or any other drug to manage sexual anxiety, Dr. Bodu? Is there a psychotropic or any other drug?
So as part of management, like I did say, we need to, do an assessment. Assessment here, the fact that you come, we talk. If there are some specific texts we have to do, we would have to do. So again, management will stem from what the identified risk factor is. So apart from the, simple things that we have talked about, hygiene, communication and all that, sometimes these simple things will not work. So then you need to go into therapy. So sometimes talk therapy, there are different forms of it where you engage a specialist on this and then they help you out of it. Apart from that, there are medications, but we are not here to be mentioning medications, that will solve people's problems. So, and then apart from medications, of course, there are others that sometimes you would have to go as far as, hormonal replacement therapy. So depending on what the cause is, then your therapist or your health professional will prefer a particular management together with you. Actually, I must say that when it comes to these things, it is not just we suggest things, but we work together so that, you own it and then it makes it easier for you and your partner and then the therapist as well. So yes, there are medications, but we're not going to be mentioning medications here.
But I'm thinking that the medication is the last resort because it's more of psychological and communication. Yeah. When you are working together, I think that's what the problem is. Albert again, a man does not satisfy his partner's sexual orgasm with notwithstanding the remedies and legitimate methods, since the woman has a natural delay Albert will kill me, delay orgasmic period. Can it be said that both partners are not sexually compatible? Albert.
Albert, I think that you have presented a scenario, but this has to be, we need to do a proper assessment. So we need to, talk to the man, we need to talk to his woman as well. And then we can agree on what the challenges are. So we cannot say outrightly that they are not compatible. No, we haven't got into that point. We need to do an assessment and then there could be some interventions and all that. So before we get to the point where we say these people are not compatible, we would have gone through a certain process. So it will be very inappropriate to say at a goal that these are incompatible. Thank you.
Thank you. Roger Bedao, great presentation. Keep it up. We need more of this educative seminars, if possibly monthly. Thank you, moderator and the resource persons. Yes, thank you, Roger. In actual fact, we've been doing it every monthly. Last month, we did social media and cyberbullying. Let me change this thing. So this is the link to what we did. I've just dropped the link for the social media and cyberbullying, a very fantastic program. So you can have a look at it if you are interested. Okay, Sarah. Sarah's, I'm looking for Sarah's contribution before I get into trouble with that one. trying to explain the age restriction factor. So if the woman is unable to engage in certain styles, it may put the men off. So I don't know how this age factor, this styles factor contributes to sexual anxiety. But I'm thinking that that is the point that she wanted to make. Unless for sure you understand her much better than I do, and you want to say something to that.
Doc, can you please give me the question again? I didn't get it fully. I was trying to read it.
She made an earlier comment. Let me get it here.
Doc, let me help.
Okay,
the way
fine.
I understand it. So what I think Sarah is trying to say is that as people age naturally, there are certain positions or their physical bodies are unable to do certain things. Okay. And so because of that particular impairment, it puts certain men off because maybe he wants to be very audacious and do some very crazy things, which might reduce the desire to engage. That's what I understand Sarah saying, that age can be a factor that impedes performance because you are not able to do the things that you would have done in your youthful years. I guess that's what Sarah is trying to put out.
Okay, I have two hands there. Let me get them to make. Adwa Pra.
Yes. Hello.
Go ahead. Yes.
Thanks for the opportunity. So when it comes to anxiety, when it comes to having sex and all of that, I'm asking if I want to find out from your resource persons what their take on using sex toys is. Because if indeed the guy is not able to satisfy the partner to an extent, is the use of sex toys as an intervention good or bad? What is your take on it?
Okay, so sex.
Yes. So usually, if you look at the recommendations for why you want to use an enhancer, okay, and I consider this as an enhancer. Now, I tell many people that if you are in a relationship and you are doing everything and it's working, don't start using a sex toy. And there's a reason why we normally say this. Now, what sex toys do is they increase the euphoria, but as part of increasing the euphoria, there's something that occurs in the brain's level, which is the way it increases dopamine, okay? Now, dopamine, therefore, would be more than its optimal level in the brain. And what this does is that it makes your brain used to that level of stimulation that perhaps physical stimulation may not be able to give you. So it will give you the stimulation, but it will not give it to you to that height that you'll get when you're using the enhancers. Now, sometimes you may recommend it for people who are in a relationship where you have an incompatibility with performance. So one person, especially maybe the woman, finds it extremely difficult to achieve orgasm. So then you want them to agree to use it and you are recommending it. You are not saying you must do it. Partners must be willing to accommodate it within their sex life. Now, in our part of the world, one thing I notice is for many men, they hate the fact that they hate hearing sex toys because it seems like it's replacing them. So it still comes back to the preferences of the persons. But if you haven't started using it and everything is working fine, please don't use it. That is my stance on sex toys, really.
Okay, let me hear Fosia. Fosia, what is your perspective on that?
Well, I tend to agree with Tess on the issue that if you haven't used it and what you are doing at the moment works, then there's really no urgency to add it. However, I also attend to couples where they say that using some sex toys enhances the experience for them. As long as you are not getting addicted to the toy, where it is replacing the man as said, because men have, biology and being able to start is a big thing. It's part of the ego of the man. So the very minute that the man feels that you are replacing him with whatever it is, then there is an issue. But then I also believe that, as Adjoa said, sometimes, and as said officer, sometimes you might need the use of some sex aids. Of course, there are so many sex aids on the market. And before you even use one, you should be able to educate yourself on the harmful effects of it, what it causes and all that. There are some that eventually they will lead to some issues with the canal, even with women, the canal for us. So if everything is working fine, I wouldn't recommend a sex aid too. But then in the issue of maybe with a woman on inability to achieve orgasm, sometimes it helps to spice up the sex life, as long as we are not becoming solely reliant on it, and as long as it's not taking the place of the individual.
Okay, but don't you think that there is more to it to address question that she thinks it's necessary for her to have help, so that conversation could be enhanced, so that they know which path that they need to take.
Oh,
so
yes.
I think that there's more to it, that further questions need to be clarified.
So it also helps to see a sex therapist. I would recommend seeing a sex therapist. That's something I think before you use these things, you should educate yourself first. So it helps to see a therapist, a sex therapist, and have this conversation as to what it is for. Maybe there might be another way.
I was thinking that even if they come to you, you can have that conversation to know which path they will go. They don't need to go to sex therapy.
So Dr. I'd like to say something
so
very quick.
Therapy. Yes.
I'd like to say something very quick.
That with communication, it's always good to know what I like, what we as individuals, what we like, what we find exciting. It helps, when I talk to this way, does it help? So we facilitate that information. We facilitate that conversation. Yes.
Okay, good. All right, Seth.
So Dr. I was talking about the fact that when it comes to anything that offers pleasure, it's something you can get addicted to. You see?
It has a potential.
Now, so one thing we are cautious of is the fact that when you are engaging in anything that offers pleasure beyond your normal coping level or beyond your optimum level, the tendency to get an addiction is equally high. And that could, in a way, interfere with other facets of your life. So you're trying to spice up your sex life and you end up replacing your partner. And that becomes another problem, which might then come back to influence even the sexual anxiety. That's why we're always talking about when it comes to using sex toys, if you haven't started. So I tend to ask lots of my clients who use these things, and I ask them, is it ever okay? Do you ever enjoy, without it? Anyone who says, oh, yes, I say, oh, then that's fine. It's an adaptive use. But majority of them say it's difficult, to the point that sometimes they may finish a whole act. They might orgasm or ejaculate, but they have to go and do again with their sex toy in order to feel comfortable. And that's problematic.
Okay. Well, in that case, that they need to see the professional. Let me hear from, I have two hands. Let me hear from Yusa. Then the name is Yusa. Yusa, let me hear you. You can unmute and let me hear you. Yusa, we cannot hear you. I've unmuted you, but we can unmute yourself and let's hear you. Oh, we cannot hear you, Yusa. We cannot hear you. Have you unmute yourself, please? We can't hear you. Let me try Nana Kojo. Nana Kojo, are you there?
Yes, I'm here.
Yeah.
First
So
I want to congratulate the Fuswa. I mean, for all the Fuswa for sure, because she's my mate, so I'm very grateful
Okay.
for her being one. But I want to for my follow-up question that it's abstaining from sex. Can it affect a man? Is it priority a man to get prostate cancer?
please repeat your question again, please. Hello, Nakojo. I say that if a man abstains from sex, is he prone to having prostate cancer? I think that's the question. Yes, Seth.
Well, there are some researches, I mean, even though they are not conclusive, that says that when you are not engaging as much, it has risk factors for prostate cancer. But of course, the findings are mixed because some studies also say there's no effect. So for now, I can't make any significant conclusions.
Any definite?
Yes, it's mixed. Some studies say it does, some studies say it doesn't.
Okay. One interesting question has come up here from Charlotte Kwachiniakon. How do religious injunctions influence frigidity and anxiety about sex? I think that you've all mentioned it at one point in time. It does, because culturally you don't have to talk about sex and all that. So, but if you want to throw some light on it, I'll give you the chance to say a quick one on it.
I think that I think that religiously and culturally, especially for females, even not just females, it's talking about sex is almost a taboo, but it's even worse for females. So, but people are struggling. And when people are struggling about issues and they can't talk about it, then it makes it worse. And it is in the talking about it that people can get help. So yes, but I'm happy that in recent times, these are issues that we talk about. In fact, before, like Fosia said, when I started posting the flyer, you know, I had questions. And one thing I would say is that you need, even a pre-accounts we get from our churches, who are the we call counselors? What is the age at these people? What prepare the couples to be to face some of these, because there are things that will certainly come up. So yes, circles in but I think that in recent times.
All right, let me try user one final time, then we can bring the session to an end.
Issues, but I
user,
think there's a lot more.
Please unmute yourself. I'll unmute you here. Muted.
Probably he's not around.
Amma, can you hear me? Fosia, can you hear me?
Yes, I can hear you.
Yes, I can. Okay. I can hear you.
Yes, I think we've done justice to this topic, that we've achieved our objective, and I think we need to give an applause to ourselves that we've been able to do justice. there are more comments coming, more hands raised, but maybe I'll have to think of a way to do a part 2 of this one. Winifred wants my number. When you send, please send me a text and mention your name. Without that one, if you call me directly, I may not pick depending on what is going on. So, Winifred, my number is 020-1650-749. Again, 020-1650-749. Send me a text first before we can start talking. So we've come to the end of today's program. I think for appropriate coping strategies or remedies, I think that one, we need to do that psychological restructuring. We need to talk and communicate with ourselves. These are key. We need to know ways of dealing with stress. And when there is a problem as a couple, you need to talk about it. And there is the option of therapy too. There is the option of therapy. So that with this, all other methods, you stop the headache, you stop the tiredness, turning yourself into a workaholic when you really are not a workaholic, staying out with the boys when you have to come home, all this. And of course, we need to have exercises and develop good personal hygiene. Develop personal hygiene. I think that when we practice all this, that relationship will be healthy and all the benefits associated with it, like Fosia said, it will be profitable. It will be profitable.
Very important.
Somebody just asked of the recording. Yes, we have all the recordings on YouTube. This one would come up perhaps after the holidays, but the previous ones that you've done, just type in MHA episode 1 and you would have all that has come, including the one that are shared. So this one will come up. So on that note, I want to say a very, very big thank you to our panel members, Dr. Amabuedu, Abna Fosuya, and Seth Asafo. I cannot thank you enough. The words cannot express how much grateful Mental Health Authority and our participants are grateful to you for that wonderful presentations that you've made to this. At least, if for nothing at all, we solved Winifred's problem. If for nothing at all, if for nothing at all, we solved Winifred's problem. And so I want to say thank you. And to you participants, without you, this program wouldn't be there. You always come. So we also thank you for being part of this program. God willing, next month we have Schizophrenia Day within that month. So most likely we'll be discussing something on schizophrenia. Every month we'll do a seminar. And so we'll be discussing something on schizophrenia. If we are well and healthy, we'll always meet here, same time next month. So I want to say thank you to all of you and enjoy this long holiday. If you have anxiety issues, by the time the weekends end, you should solve it, because psychological restructuring, communication, personal hygiene, exercises should be able to do the trick for you. Thank you very much and enjoy your weekend. Bye for now.
Thank you, Dr.
Winifred didn't get my number. Winifred, I'm saying that my number is 020-1650-749. Send me a text first, then I can respond to you. Don't call me straight away. I may or may not pick. So send me that text, then we can take it up from there. All right, enjoy your weekend.
Bye-bye.
Bye-bye then.